People do slow down as they age. That's true. And some component of that is biological. The fact that we do stop moving does cause certain things to atrophy. And then one day, all of a sudden, we decide to go play basketball and tear our Achilles tendon, right? So there's natural aging, there's lack of use, deterioration that causes easier injuries, and just in general, you're gonna get slower. I mean, I think that's why the average age of the 100-meter sprint champions usually like 26, right? We're all gonna get slower, that's for sure. But slow down, like in a general sense, as far as moving less, that is honestly what speeds up that decline. The older we get, actually, the more exercise in general that we need to prevent that deterioration. It's just more energy required to prevent that entropy, the falling apart. This is not intense exercise. This is just a debt that we all owe to the universe. This zone 2, the walking hours per week that we need to be doing this. As that goes down, then our metabolism stops working so well and everything starts to decline. There is some component of us that has to kind of reject this and understand that we do need to keep moving, probably more as we age. It's just the way it works, and I didn't write the rules. Yeah. But the thing that really changes the trajectory for somebody is the amount of time that they can stay active. And so we forget sometimes about how important it is to prevent injuries. The person who can stay training the longest is going to benefit the most from that. Understanding that, being smart about it, really thinking about this on the long term, when we're younger, we tend to direct our exercise more towards things that help us achieve these great feats of strength. Those aren't what we train for as we get older. How do we keep the body moving and make sure that we have as much or as little time off from injury as possible? 150, that's 2.5 hours. No. Way too little. So also, just the definition of this, of you need 150 minutes of moderate cardio. We're losing the plot. You need way more than that, and it doesn't have to just be this moderate cardio. It can be less moderate cardio as well. It can be walking. And to be honest, you need at least 4 hours of some pretty moderate cardio per week. So that number is way too low just on that stance alone. I think what we need to do is expand our definition of what that cardio is, combination of walking and zone 2, and we're probably looking above 100 minutes a day for this type of stuff. That's the level of activity. If you're doing this right, you're getting about 100 minutes, probably more, of training, which we've now changed the definition of to include this walking. That's so important, and they're way off. Now on the strength training, 2 times a week, yeah, I prefer 3. Look, on some weeks you can't get there the 3rd day, so two will work. But in general, 2 to 3, yeah. If you're below those numbers or we're starting from 0, you don't necessarily need to come into Preamble and get a VO2 max test and get your custom heart rate zones and stick in your zone 2. You're going to benefit so much from just walking around the block, increasing that the next time, to being able to get near daily walks of at least a mile, moving it up to 2 miles. Now, when things are looking good, I think you're getting at least 3, 4, 5 miles of intentional walking or that equivalent for movement per day. Just something. I mean, the biggest benefit we get in this world from anything is starting from 0. And so the amount of improvement that we have just sitting right in front of you from turning 0 into 1 mile a day of walking is immense. So let's not underestimate that.